Hi, it's counselor and educator Dr. Greg Jantz. 40 years of being the founder here at the Center of Place of Hope in beautiful, I'm looking outside the window, beautiful Edmonds, Washington. I want to talk about cognitive behavioral therapy explained, CBT. We hear a lot about this in the counseling field. What is CBT? The person will go, I'm trained in CBT or I'm practicing CBT. And let's talk about what it is. It's just one of many tools. It's generally, but not always, used for more short-term type of counseling and therapy. It's an intervention where we can train and teach different ways of thinking, controlling our thoughts and minds. And its focus, and I made a note here because this is important, on changing unhelpful thinking and behaviors. So as we think, tells us how to feel, which tells us how to behave. So it's helping you follow that chain. How we think tells us how we feel, how we then behave. So it's a way of addressing that early on thinking part. And it does work well. Obviously limitations, but it works well with a broad range. It's a good place to start. Broad range of, sometimes it's referred to as behavioral disorders, but cognitive behavioral therapy. It's really based on the idea that your thoughts can change your life. And I'm not going to say it's going to change your life, but it can have a big impact on your life. How it works, you can learn to recognize the negative thinking that maybe you don't always recognize, or what we sometimes refer to as distorted thinking. And you can challenge those perspectives with healthier, more realistic ones. And you can practice new behaviors, ultimately practice new behaviors to help you change emotional growth, help promote emotional growth. If I can think clearer, think better, be less impulsive in my thinking, less clouded, less anxious, less foggy in my thinking, then that can affect a whole lot of things. And that's where cognitive is my cognitions, or my thinking, my brain. It can be, and usually it's taught to help with depression. Again, let me just mention, there are many other intervention tools that we use. There's EMDR. I know there's always these weird abbreviations, but it has to do with rapid eye movement and how our brain functions. There is DBT, dialectical behavioral therapy, which has to do with emotion regulation. So I know some of these sound strange, and CBT, cognitive behavioral therapy, but they're tools, and not any one singular tool is going to work or fix everything. That's why we want to use the whole person approach and deal with the whole person. What this looks like is, I'm going to look at, well, what do I believe in the faith department, spiritual? What's my history with trauma? What are my relationship patterns? What's the relationships I'm in now? What's my early on upbringing that influenced my self-esteem and my self-opinion of who I am? All these things, the whole person approach has got to look at this. And a lot of times with cognitive behavioral therapy, it can be really helpful when there's been some irrational thinking that has emerged because of trauma. But what happens is it doesn't necessarily help us resolve all the trauma. That's why we need to look at other interventions. It is effective, though, because it gives you tools that you can use outside of the counseling office, because you're learning new skills. And it does help. It's one of the greatest tools to help with emotion regulation, so that your emotions are not driving you. You're able to intervene at the thought level. And these are skills that are taught and practiced, and that key is going to be practice. It does help us empower us to really be engaged in our own recovery, because you're learning new tools. And I like to use CBT when we're doing group therapy, we're doing individual therapy, we're looking again at the whole person. So is it right for you? Yeah, Can anybody benefit? Absolutely. We all can benefit some of the strategies and skills and tools of cognitive behavioral thinking. And sometimes people go, wow, I can't believe I've been thinking that way. And now I see where that my thinking came from. And you begin to look at it and go, I understand this is not healthy, and you're able to adjust it in practice. So healing is possible as we begin to look at how we think. And then that dictates, of course, how we feel and then our behavior. So we want to change that trajectory than when it's negative. So you can take care of, and I'm going to say there, you can take care of thoughts, but that's not the core issue that's going to need healing. But that's where CBT can be super helpful. Look at the different options that we have, because this again is a good tool, not the only tool, but it's a good tool as we look at emotions and emotion regulation and how we think. So, but look and see the different options that are available at aplaceofhope.com.